Hello, everyone, and welcome back to those who joined part one of our leadership series, and welcome to any new folks joining us today. And maybe you've had a chance to check out part one on YouTube, but welcome everyone for our leadership series of the Hope, Healing, and Recovery Exchange, brought to you by the Health and Community Care Worker Wellness Working Group in the Hamilton and area region. My name is Dr. Joe Palazzari. I'm a clinical psychologist at St. Joseph's Healthcare Hamilton, and I'm also a member of the Coping and Resilience Support Team, a staff support initiative here. I'm coming to you from my office at the Charlton campus in downtown Hamilton. Co-facilitating with me today is Kiran Sidhu. Kiran, do you want to just introduce yourself and lead with the land acknowledgement?
Yeah, thank you, Joe. So my name is Kiran Sidhu. I'm the operations lead at the Greater Hamilton Health Network. I also work at the Hamilton Family Health Team, supporting the psychiatry program. Next slide, please. So I'm just going to read the land acknowledgement. The city of Hamilton is situated upon the traditional territories of the Erie, Neutral, Huron-Wendat, Haudenosaunee, and the Mississaugas. The land is covered by the Dish with One Spoon Wampum Belt Covenant, which is an agreement between the Haudenosaunee and Anishinaabeg to share and care for the resources around the Great Lakes. We further acknowledge that this land is covered by the Between the Lakes Purchase, 1792, between the Crown and the Mississaugas of the Credit First Nation. Today, the city of Hamilton is home to many Indigenous people from across Turtle Island, North America, and we recognize that we must do more to learn about the rich history of this land so that we can better understand our role as residents, neighbors, partners, and caretakers. We'll pass it back to Joe.
Thank you, Kiran. And just to review some of the ground rules today, all the participants are going to be muted. Just a reminder that this event is being recorded, and all of our Hope, Healing, and Recovery Exchange events are on YouTube, so you can always catch our previous events and also this one within a number of days. The chat box will be available during the Q&A portion of the event, so we'd like to engage you and see if we can answer some of your questions, or please also feel free to share some reflections in there as well. A list of resources will be shared with you at the end, and a link to an evaluation survey will be shared by email after the session, and we welcome your feedback and any suggestions for future events. And so just to review quickly the goals of the Hope, Healing, and Recovery Exchange, we want to honor the diverse experiences of all of you in our community throughout the pandemic and promote collective reflection, mutual support, and recovery. We also want to hear personal stories of overcoming challenges, and we have someone on our panelists that will do that today. And of course, we want to increase awareness of available resources for all healthcare and community care workers. And thank you to all our partners from the Health and Community Care Worker Wellness Working Group. You'll see a number of agencies represented here. So thank you to all of them, from the hospital sectors, from care homes, from public health, from community agencies and primary care. So again, these are all our partners, and we thank them for their support today. And so I'd like to reintroduce Dr. Robert Maunder. Dr. Bob Maunder is a psychiatrist at Mount Sinai and also a professor of psychiatry at the University of Toronto. He is the lead author of the report, Burnout in Hospital-Based Healthcare Workers During COVID-19. That was from the COVID-19 advisory for Ontario. I noticed the date on there. It's about it came out about a year ago. Dr. Maunder's been very generous to join us in these sessions with a spotlight on leaders. And Bob, I'll just hand it over to you to maybe bridge a bit from the last presentation and getting into some new content for today. Dr. Maunder.
Thanks very much, Joe. So, yeah, please move ahead to the next slide. So whoops. I wanted to pick up exactly where we left off last week. So this was actually the last slide of my presentation last week. To kind of start with the idea that leaders in healthcare organizations experience all of the same burdens as everyone in the organization, plus some special ones just for them. And in particular, that the leadership role places some extra strains and some constraints on dealing with the stresses of a situation like the pandemic. So next slide. There were a few unanswered questions at the end of the last session, so I thought it would be helpful to begin with those, not because I'm going to answer them specifically or in detail, but to kind of set the stage for talking about some aspects of organizational leadership that can address important questions like these. So how do we engage and support our staff when they are feeling disrespected from without, from the media, from government, even from their own administration? A question about how we're going to engage and retain new staff. Last week we'd mentioned younger staff, and one of the participants pointed out that we're also bringing more new Canadians into healthcare organizations, and there may be additional strategies and resources that could help them to fully engage in our organizations. How do we get staff to buy into self-reflection and wellness activities? There's a lot of kind of wellness and resilience fatigue and dare I say cynicism over the course of the pandemic. And so it's increasingly a challenge to get people to engage. And then a question, because we'd been talking about how middle managers can be kind of caught between downwards pressure from senior managers and the upwards needs of their staff. And somebody pointed out that there's also a kind of sideways pressure, which is an interesting phrase, about having to adapt to new ways of working. So with Zoom and more email and less face-to-face contact. So I'm going to talk at a higher level than specifically responding to these questions, but these are things that we can come back to in the Q&A. Next. Working with great colleagues, I've had a couple of opportunities to review the literature about how we within healthcare organizations can support staff. Most recently in the science table brief that Joe was referring to, but previously in the preparation for the H1N1 expected pandemic a decade ago. And the evidence is actually fairly similar now as it was then, and points towards the best evidence being that the value that we get from training our staff so that people feel greater confidence, greater self-efficacy in doing their work, which is quite protective against the chronic effects of stress. The characteristics of magnet hospitals, which I think is a concept that's probably familiar to many people in the audience, and I'll try and speak to that in the next few minutes briefly, and if I don't, feel free to ask me about it later during the Q&A. The characteristics of organizational justice that are actually supportive not only of the mental health and well-being of staff within large organizations, but even their physical health. Because there's been a longitudinal study that organizations that have just processes, in fact, have physically healthier staff over many years. And in particular of relevance to what we're talking about here in these sessions, the importance of leadership to the well-being of the organization and people within the organization. And what the literature consistently points towards are the benefits of authentic leadership. And so I just thought it would be helpful to kind of unpack exactly what that means, because it's an important concept, but it's also a complex one. So what can we do to provide authentic leadership within our organizations? Next slide. So there are actually quite a few different versions of what the construct of authentic leadership means. And so I've chosen one from a paper from a few years ago, which was a synthesis of the literature that existed at that time, and I found it to be a useful one. So that identifies 4 elements of authentic leadership, which are self-awareness, transparency, what they call balanced processing, and an internalized moral perspective. And what those constitute is a little bit more self-evident for some of them than others, so I thought it'd be helpful to kind of just go through them one by one. Next. So if we're thinking at the level of individual leaders, so that each of you who are present today, self-awareness refers to understanding how you make meaning of the world and appreciating your impact on others. So this is about knowing your own biases, knowing your own values, your strengths, your weaknesses, and knowing them so that you can take them into account, so that you'll be acting with awareness and sometimes suppressing your biases as well, in order to take the opinions of others into account, right? To be able to act on your strengths, to be able to collaborate with others and recruit other perspectives to help you work around your weaknesses. So that kind of self-awareness is one important aspect of authentic leadership. And next, transparency means be yourself. So this is maybe like the most clear and in some ways one of the more tricky aspects of authentic leadership. Because what this means on the surface is perfectly straightforward, right? Say what you mean what you say, be your own person, and express the emotions that are actually authentic expressions of how you feel. The tricky part is, of course, you don't get to do that 100%, right? Because self-disclosure is important, but judicious self-disclosure in the service of the relationships you're maintaining and the people who you are leading and the values of your organization are critical. And well-regulated expression of emotion. There's in the earlier study leading up to H1N1, we looked beyond the scientific literature. We looked at the business literature to find what was known about resilient organizations. And one of those studies pointed towards a private banking company, actually, that was in the World Trade Center's towers when they during 9/11. Where many of the people within the company were killed in those attacks, and most of their assets were lost, and it looked like the company was decimated. But they actually bounced back and were very resilient as a business organization and thrived within the year or two after those attacks in a way that was most unexpected. And when they looked at that as a case study, they identified a couple of aspects of the leadership within the organization that were important. And one of those was that the leaders of that company expressed how they felt. They expressed their care, their concern for the people within the organization. They cried because it was an awful event. They were not stymied in being able to respond as real human beings to a terrible tragedy. And that leadership was really helpful for their organization. Next slide. Balanced processing, at least to my ears, is the least transparent of these terms, but it refers to something pretty straightforward, and that is not reacting reflexively, but taking taking all perspectives into account before acting. So it means listening to others, right? So lead with your ears, allow people to challenge your perspectives. And this is where you can see how these things go hand in hand, right? That the self-awareness that allows you to know your biases and your strengths and your weaknesses also allows you to listen well to others when they're challenging those and providing complementary perspectives. And then the fourth is to have a moral compass, right? And I think very challenging during times like these to allow those principles to challenge the pressures that you experience to follow what the rest of the group wants to do and to act kind of in ways that are expedient. And that was the second aspect of that banking firm, which was Sandler O'Neill. So the one was the transparency of the leaders, but the second was that company dedicated itself to making sure that they looked after the families of the people who had died during the attacks, that they looked after the survivors of their own company, and they kind of led with a moral perspective that drew a great deal of support from everybody around them and helped them to get through it, to thrive. Next slide. There are versions of those individual qualities that apply to organizations. So appreciating the impact of your organization on its people, being clear and timely and transparent in communications to the entire organization, being deliberate and inclusive in planning, and having just processes. Which refers to relational justice, so which is the same kind of things that I've been emphasizing individually, right? So listening well to people, suppressing your own biases so that you can deal appropriately with perspectives that are raised to you. But it also means formal processes that deal with inequities in a way that is transparent and fair. Next slide. So that is all I want to say about authentic leadership. And I want to take a couple of points that move beyond that to other aspects of leadership that address some of the questions that have arisen, and maybe make a segue into the next portion of our presentations today. One of those is about modeling behavior, because one of the questions was about how we engage staff in self-care. And one of the things that I've been peripherally connected to some of the support and self-care activities that have been going on at Sunnybrook during the pandemic, where they've provided peer support in ways that are similar to what's been done in some other organizations. But one of the observations that's come out of that work is that the units that really engaged well with that support and therefore benefited from it more are the ones in which the leaders were clearly supportive of the work. Introducing it, creating time for people to participate in it, and ideally participating in it themselves, right? So by looking after yourself and participating in self-care, engaging with wellness, it actually models behavior that is good for those around you as well. I would always put in a plug for going with the evidence which is harder than it sounds sometimes, right? Because it's actually hard to collect good evidence for the kinds of things that are useful to do to support the wellness of an organization, but it's out there. And because so many of the things that we can do to support our staff and our organizations are actually not within our power to enact. For example, making sure that people get paid what they're worth. One of the things that we can do that is good for our people, but also good for ourselves, I think, is to be good advocates. And that is to advocate to those that can respond to those goals for the things that are not within your own power to deliver. And I will pause there.
Thanks, Bob. Thanks, Bob, for that great summary. And last time and today, just kind of getting kind of like the state of the art here. And thank you for your contributions and putting these summaries out there. I think what we're going to see now is some of this content come to life. And so I will just hand it over now to Kieran to introduce our other panelists today. Kieran?
Thank you, Joe. So I'd like to introduce Bahar Karimi, who is the administrator of Idlewood Manor, a 192-bed nonprofit LTC residence in Hamilton, and the chair of research at Thrive Group. She has held frontline positions as a personal support worker, registered practical nurse, and registered nurse. Bahar has a master's degree in nursing, as well as a master's degree in health administration from the University of Toronto. She's also a certified health executive with the Canadian College of Health Leaders. She's currently in the process of completing her PhD in nursing, leadership in health services delivery at University of Western Ontario, and her thesis is focused on the sustainability of the LTC workforce. Currently, she is also the president of the RNAO Hamilton chapter, and I'd like to pass it on to Bahar now.
Thank you so much, Kieran. Thank you so much, Joe. Dr. Monder, that was absolutely inspiring. I was getting goosebumps while you were talking, and this is good when science gives us goosebumps. I love that. Really, really similar to what Dr. Monder has been sharing with you. I would like to share some of our experiences, and I'm saying an hour because this is really a representation of my leadership team, my leaders at Thrive Group, and my own leadership team at Idlewood Manor and the rest of Thrive Group, because we have very similar experiences, many of us, and I can probably say many of you in the audience have very, very similar experiences that we have gone through, and some of those approaches and strategies that we have utilized. So hopefully, as Joe mentioned, some of this will come to life now for you as a real life experience. Next slide, please. So every single one of us are professional jugglers, aren't we? We have many, many responsibilities. We wear many, many hats, and it is easy, especially in situations like we're at, with so much uncertainty and a situation which we're still in the middle of the pandemic, but we think it's post-pandemic. It's very easy to get overwhelmed with all of those balls that we have in the air. This is a concept that we have been talking about over the past several years, even before pandemic. And it's easy to get overwhelmed if we don't look at every single ball as a separate entity and we don't compartmentalize them. It's very easy to all of a sudden drop all of the balls because we just cannot keep them in the air. But what we have realized as leaders, and specifically my team, we have constantly talked about this, that not all of the balls in the air are glass balls. So it's not glass balls that they're going to shatter if we let some of them go. Some of these balls can bounce back. Some of these balls can be passed on to someone else that might actually keep them in the air even better than us. But definitely some of these balls are glass balls that we need to keep an eye on them. Our balls are different, but I can tell you something that we have in common. Our health and our well-being is a glass ball that all of us have in common, especially as leaders. Not only we're responsible to keeping that glass balls for the well-being ourselves, but definitely we have a bigger responsibility, because if our cup is not full, if we're not at our best, we won't be able to be at our best as leaders, and that influences our teams and people that they're looking up to us. Next slide, please. So really important, as a team, while we're going through the pandemic and the pressures of everything that was happening in the world to us, we realized that we really need to check in and gain that self-awareness that Dr. Monder was was mentioning, that self-awareness journey was different for all of us. You know, I actually had a different strategy than my other team members to get to that self-awareness. What we realized, we need to understand what our values are, what is actually filling our cup, what is giving us that passion and energy every day to come back for more and more. What are our triggers? What makes us upset? What makes us ill? And how are we feeling right now? You know, we definitely experience many feelings, but how are we feeling right now? And what will make us feel better? Because my self-care journey can be very, very different than yours. And what fills my cup, what might be very, very different than what fills your cup. So understanding of what makes me feel better was something that we intentionally practiced. Next slide, please. So me personally, I found that mindfulness practices were very, very helpful to me, understanding how I can actually realize what my triggers are, but go deeper. Why is this a trigger? Understanding a trigger is one thing, but where did I get to this point that this is a trigger for me? Is it based on my personal experience from the past? Is it from trauma? What can I do while I am going to be mindful of keeping my trigger reflections in control? What can I do to actually maybe make it better? So next time I'm not as triggered as I am with this situation. So that practice of mindfulness was really helpful for me to understand myself, to understand my values, to understand my triggers, and eventually be a mindful leader for people around me. Because if I get that control over my emotions, I would be more compassionate towards other people with their obviously very, very different reflections. And I can actually support them throughout this journey that we're all going through right now, with more tolerance and kindness. And many of my team members practice other strategies in order to gain that self-awareness. Next slide, please. So that was, you know, who am I perspective and how am I doing right now? And this needs to be a reflection, a daily practice. Am I healthy? And it's beyond, you know, okay, my tooth is hurting, so I need to go to a dentist for a checkup, you know, or going for my annual physical, but our mental health, our emotional health, how am I doing? And understanding that this is a continuum. It's not just, you know, healthy, ill, but can be actually a process to get from healthy to ill. So really reflecting every day to understand how we are doing as people, that which can lead us on how we're doing as leaders, were very, very helpful for every single one of us. Next slide, please. And understanding of, okay, so today, this is how I'm feeling over the past several weeks. This is how I feel I am doing. So what am I going to do to address that? So that was also very important for us to understand that there are some strategies that we need to put in place in order to get back to our healthy self. Next slide, please. One component that was very, very important, we had many conversations as team members about this, was reaching out for support. So everything that I have told you so far has been around, you know, personal strategies, but understanding of there are other people, there are experts, there are resources available to us, so we don't have to do this all by ourselves. That was a game changer. I reached out and I did a self-assessment referral for mental health services myself for the first time in my life. And when I actually got connected with a therapist at St. Joseph's Hospital, that was totally a game changer for me. And I wish somebody was pushing me to do this sooner than last year. Definitely reaching out for support was something that all of us got to practice and was very, very helpful for us to move forward. Next slide, please. So, understanding ourselves, what fills our cup. For me, it was that feeling of happiness every day. I realized that is going to be much more influential for me and impactful for me than any any going to a spa or going to gym or anything else that might be a self-care for someone else. For me, was those daily dose of self-care through the happiness chemicals. And I want to leave this DOZSE, dose, with you, which is from dopamine, oxytocin, serotonin, and endorphin, because I'm hoping that you actually Google it and learn how to hack those chemicals when the situations are not perfect, when these hormones and chemicals are not released naturally, how we can hack that, because that's what we did within our team. Next slide, please. Realizing that those hormones can be released in a loving environment, which also studies show that in workplace cultures, when you have a culture of compassionate love, the employee outcomes and the client outcomes are actually impacted positively. We came up with some strategies, and I'll be just sharing 3 of them with you, how we actually created a culture of compassionate love within our team to hack those happiness chemicals on a daily basis within our team. Next slide, please. So really practicing compassion, which is above empathy. So empathy is when you try to understand the perspective of other people when it's not aligned with yours. And compassion is intentionally wanting to do something for those people that their perspective might be different than yours. Next slide, please. Enthusiasm and optimism, understanding that it's okay not to be okay, and knowing that we are not 100% and optimistic and positive on a daily basis, but knowing that when we are, we need to spread that because it's contagious and it can boost up the morale within the team and within our home specifically. Next slide, please. And relationships and trust, which is fundamental to any kind of leadership journey and model, but also it is supportive to create that culture of compassionate love. If there's no relationship that is actually based on caring for the person, not caring for them because they work for you, because they're, it's a position, because if you care for them, they will care about your clients. No, but caring for employees and team members as people, not wanting anything in return, but actually caring for them from the bottom of your heart and doing things for them was fundamental. And it impacted our daily interactions and perceptions of the situations within our team and our clients, which was super helpful to create that culture of compassionate love, which was supportive for us to move forward and to feel well and to be very tolerant with all the uncertainties that is happening around us on a daily basis. So that was what we did at Thrive Group and Idlewild Manor. It has been very, very helpful to keep us well and to support us to move forward in an environment that we're dealing with a lot of uncertainties.
Thank you, Bahar. That was very, very inspiring. And you really did bring a lot of this content to life in sharing your personal story. And I really thank you for doing that today. Very also kind of brave disclosures too around seeking out help. And I'm so glad to hear that went smoothly for you. So again, thanks for sharing this story of leadership in the long-term care sector.
Thank you, Joe.
You're very welcome, Bahar. I think what we're going to do now is, just given the freshness of your presentation, to maybe open it up to some Q&A and some reflections that Kieran, myself, and Dr. Monder and Bahar can maybe facilitate a bit of a discussion.
So we have our first question, Joe. This is actually for Bahar. Have you found that this approach has impacted employee retention?
So this is a really, really, really good question. And I want to say yes, it is a little bit difficult right now to measure the sustainability of the approach that we have utilized. But I would say compared to what I hear is happening within other long-term care homes in Ontario, it seems like we're doing well. Just like other people, we have been utilizing the support from agency partners. But when we look at our numbers, our retention is actually looking really, really well. So is it because of this approach? Not 100% sure. But we're doing well, and I want to say that this has had some impact on what we see.
Thank you, Bahar, for sharing your answer. We don't have any more questions right now. If anyone else has any more questions, please pop it in the chat or ask it in the Q&A. Maybe Dr. Monder, do you have any thing to add to that?
It's very hard, I think, right now to measure whether anything is effective in terms of retention of staff, because it's working against such a strong tide of difficulties maintaining staff right now, right? So I think it's really encouraging when an organization is doing well compared to their peers right now. Which is probably the best you can do in terms of gathering evidence at this point. I'm wondering if there are not questions coming in, whether we might go back to some of those unanswered questions from last week. Not that I have great answers that I'm dying to give, but it would be good to give them some airtime from all of us.
Yeah, I can read that off. So the first question was, how to engage and support staff when they feel disrespect from administration, media, and government?
Yeah, so that of the questions that I summarized on that slide, that was the one that was maybe most directly addressed by the kind of principles of authentic leadership, I think, right? So, and modeling, engaging in your own wellness, and engaging in the kind of organizational resources that are supportive. There's a kind of I was going to call it a subtext, but I think it's not as subtle as a subtext in that question, that responding authentically to people who are feeling disrespected generally in multiple domains is really challenging, right? Because we want to be able to provide supportive communications to people, but people have long antennae for things that feel insincere, right? And so if it sounds like you're kind of speaking the company line rather than providing authentic support and responses, it tends to ring hollow. So it's a real challenge to be able to acknowledge what I think are often, in fact, disrespectful circumstances, right? I mean, the reason why healthcare workers feel disrespected by government, by media, by the public is not a misperception a lot of the time over the last couple of years, right? And so to be able to acknowledge that and engage in real conversations with the people that you're working with, I think is doesn't solve those problems, but begins to build upon trust.
Thank you.
I can add to that, Karen. And I totally agree with everything Dr. Monder shared. Something that I want to add is for individuals, that journey of self-awareness is very important. When we realize what our values are, and then we know the values of the organizations we're involved with, that is when we can make a choice. It's a challenge, it's a constant challenge when you're personal values are not aligned with the organization that you're involved with. So understanding what, and I might be answering the next question that I see in Q&A as well, that, you know, when you are aware of yourself and you know what is important to you, and looking at the organization that you're engaged with, it's sometimes you can influence those values depending on who you are and what kind of an influence you have within the organization. You definitely can be part of that change and transformation, but sometimes you're not. And realizing if you're just being upset every day, if your values are being challenged every day, is this the right time for you to stay within this organization? Some people maybe even leave and, you know, get themselves more strong and come back to whatever that organization is, including some government agencies. But realizing who we are and what upsets us, and understanding the values of the other organizations is very, very important, I think, while we're doing advocacy, while we're trying to be influencing the sectors, the systems, and the structures.
Thank you, Bahar. So I think you kind of covered the first question, but I'll just read the question. What do you recommend when there is a disconnect and cynicism of the executive leadership? Is there anything you wanted to add, Bob, to that, or?
No, I think we've kind of each spoken to that in different ways. Sandra.
Thank you.
I think so too. If I can just jump in here, it's kind of like, you know, in your story, Bahar, you're talking about, you know, maybe you personally kind of being in that amber zone, right, on the stress continuum, and then you're meeting staff who are also kind of in that reactive zone. And I think you really spoke really, really nicely to kind of working through that and being able to just be open, transparent, authentic, making disclosures. And to me, it seems like that was like effective for your group in kind of working their way through maybe the sense of disgruntlement or the cynicism. Do I have that about right?
Absolutely. And that authentic leadership is so important, because people, if we have tried to build relationship with them, and if they feel that we actually care about them as a person, they're forgiving. People don't be cynical of their leaders if they're not having a good day or if they're struggling, if they know that they actually care and they're trying and they're authentic. So that conversation about obviously knowing who we are and being comfortable in our own skin and being courageous of showing who we are, with that constant hunger for growth and self-development, obviously, I think that is also very, very helpful.
Thank you. It reminds me of this term I've heard, like bringing your whole self to work. They used to say at my company all before where I used to work. So it reminds me of that. The next question is, healthcare workers are typically giving and caring to others. How do you inspire staff to turn that attitude inward without feeling weak or that they aren't doing their job?
I can comment on that first, Bob, if you don't mind. So really, it's really actually, this is a very important conversation. Healthcare workers are giving people. We sometimes feel guilty if we prioritize ourselves. So what I have been trying to, first of all, that has worked for me, so that's why I'm trying to spread it and share it with others, is what I think I mentioned. You can't pour from an empty cup. So if we can look at that self-care process or journey or strategies as investment, so we become actually better caregivers, we become better leaders, that makes us feel more comfortable and actually committed. to this journey of self-care. If it's all about, okay, I have to take care of myself because I'm important, because I have to prioritize myself, might work for a lot of people, and there's nothing wrong with that. But for many of us healthcare workers, that's not how we are. We can't prioritize ourselves. So looking at this self-care journey as investment is the key. So I hope that this will inspire some of you on the call and your team members to reach out for support and to prioritize yourself.
Yeah, so maybe I can follow up on that a little bit. It's interesting. Many, I don't want to speak of healthcare workers kind of monolithically, right? Because we're not all the same, but many healthcare workers are caregivers by nature as well as caregivers by profession, right? We just did a huge scoping review of the literature on resilience and interventions to support resilience over the last 20 years. Which is, it's thousands and thousands of articles, right? It's an enormous literature. And that one of the things that became clear, which I didn't know going into it, was that the evidence that pertains to nurses in particular and the evidence that pertains to physicians in particular is quite siloed, right? So these are kind of scholarly communities that don't communicate with one another. And they use different language, right? So studying what I think is the same thing, which is like the stress of working in this shared environment that we all work in. The physician's literature focuses on medical model things, right? So it measures depression and looks at suicide risk and burnout primarily. Whereas the nursing literature is much more focused on things that are relational and ethical, right? So compassion fatigue and moral distress and those sorts of constructs, right? And I don't think they're actually studying different things. I think they've got a different frame, right? And so, and again, I don't want to stereotype physicians and nurses, and the literature doesn't even allow me to speak very clearly about other disciplines. But but there's a sense that each of those groups have constraints on their ability to care for themselves in a way that is healthy, but the constraints are different, right? So one is kind of being in this mode of caregiver and needing to hear that message that first you have to put on your own oxygen mask before you can provide the oxygen mask to the kid, which we always hear on the airplanes. And then in the other silo, it's some kind of stoic, I don't have any needs, so I don't need to attend to them kind of attitude, I think, that that inhibits that. But in both cases, the end result is the same, and I completely agree with Bahar. I mean, that we need to model for one another that looking after ourselves is good for us and good for others, and help each other to overcome the barriers that I think most of us feel for one reason or another to a certain extent.
Thanks, Bob. And I think there was, but part of what you just said is also a response to that next question. And I wonder, Kieran, if this might be our last question before we come to a close, and we have one more engagement exercise too after this. But how about this last question, Kieran?
Yeah, I'll read it off. So why are healthcare workers not kind to each other? Disrespect, bullying, and toxic management have all led people to leave their positions in even the entire field. But why are we so hard on each other?
Yeah, so I wish I had a great answer to that. Part of the answer is what we're already talking about, right? That we're being kind to one another is not necessarily the lens that we go into this work with, right? And it's one of the first things to go, I think, in times of constraint and limited resources. If there's too few of us and too much work to do, one of the things that goes most quickly is our compassion towards one another, right? And especially in the healthcare environment, which is not like many other environments, because like the level of experienced harassment and small v violence and capital V violence for healthcare workers is really extraordinary, right? And it's hard in that kind of environment, I think, for us to kind of feel like we're all feel generous with one another, and it's the value of this kind of conversation to encourage us to find ways to keep doing that.
And I'm going to add to that, as you know, healthcare should be a sector full of compassion, and we are in the business of caring. But our workplace cultures are not necessarily structured that way. So although we are constantly being encouraged to give care and kindness to our patients, clients, residents, we're not necessarily encouraged to do that for each other. And I want to encourage everyone to maybe just Google the concept of compassionate love in workplace, because there are studies that show how we can create that kind of a structure. So when we do have those kind of structures, the incidence of bullying and unkindness will be less.
Thank you, Bahar. Thank you, Bob. I think we're gonna go into our wrap-up phase here. We want to engage everyone, the 80 plus participants here in this space in a Slido. So as we come to a close today, we'll have people engage in this exercise. Karen, do you want to introduce this?
Yeah, for sure. So if you can go to slido.com, I see that Sharon dropped the link as well. Enter the code 107723. Then you'll be prompted to answer the following question. What is one initiative or strategy that you plan to implement within your organization as you lead forward? So your answer will be anonymous, and you can type up to 25 characters, and you can also enter multiple answers. I think we're just going to switch screens now to see what answers are coming through. Wellness walkabouts. Focus on self-care. Authentic leadership. Leading with ears. I think Bob mentioned that one. Reconnecting with colleagues. I think that's especially important, especially most of us been working from home. Self-compassion. Leave toxic workplace. Authentic leadership is quite popular.
Mm-hmm.
Daily huddles in person. Leading with empathy. Open dialogue. Team conversations we have.
Yeah, this is really, really tremendous. And a lot of these themes kind of reflected in our talks today. Focus on self-care.
Yeah, listen. Leading through listening. Figure out the glass ball. Which
That's
glass
right.
ball do you have to drop?
Juggling. Oh, someone mentioned dose here, Bahar.
Yeah.
So that's something I'm going to look up too. Thank you.
I really like that analogy, dose.
And of course, I really liked the use of the stress continuum. That's something we emphasize a lot here too. All right, folks. Well, we're gonna bring today's session to a close, and if you want to review the Slido emerging, you can always do that after the event, and it'll be posted to YouTube within a few days. So there is an evaluation to complete, and that's been popped into the chat too. So please let us know how we did, and leave some suggestions and feedback for us. I also wanted to kind of share that there are resources out there. Bahar mentioned reaching out to resources such as the ones available at our provincial sites for healthcare worker support, the one here at St. Joseph's Healthcare Hamilton, the one at CAMH, and there are 5 in the province, but please reach out and use these links. So there we have it. Another Hope, Healing, and Recovery Exchange drawing to a close. I hope this format is working for people, because we have a mix of content from from conceptual, academic, or kind of science-based content, and then hearing some real stories and bringing some of that to life. So I hope you feel like we got a mix that works reasonably well here. Thank you to our partners, and for our support behind the scenes again. Sharon Munn from Public Health, Nicole Viancourt from the communication team at St. Joe's, my co-facilitator today, Kieran, thank you very much. And our guests today, thank you so much, Dr. Bob Monder and to Bahar Karimi for your generosity, and we've learned so much from you today. Thank you everybody for attending, and I hope you found something really helpful today, and I hope that joining an event like this has helped you kind of feel a sense of connection and has helped fill your cup a bit today. So thank you all to you for everything that you're doing, and hope to see you again at one of our Hope, Healing, and Recovery Exchanges in the future. And please, once again, let us know how we're doing. So please respond to those evaluations when they come along. All right, folks.
Oh, Joe, I
Take
just
good
wanted to
care.
add, actually,
Yeah,
anyone that
Karen.
provided their consent, their contact information will be provided for networking and resource sharing purposes as well. And that'll be circulated via email in a few days.
Yeah, awesome.
Thank you, everyone.
Thanks, Karen. Thanks, Bob. Thanks, Bahar.
Thanks
Bye
so
now.
much. Bye, everyone.